Hi, I'm Pamela Madsen, and welcome to another segment of Journey to the Crib. And I'm here with Dr. Dave Kreiner, who is the founder of East Coast Fertility. Thanks for joining us. With the recession and the cutback in credit for people, a lot of the traditional ways that couples were trying to have babies finance their treatment was through, second mortgages on their home, credit, mom and dad, retirement funds. A lot of these things are shrinking now, and they're not available. So what are programs like East Coast Fertility doing to help patients finance their fertility treatment?
Fortunately, we were selected by the New York State Department of Health to provide the grants for IVF. We also provide our own internal East Coast Fertility grants, and we have IVF studies as well. The New York State Department of Health grant is especially rich. Unfortunately, there's limited funding, so we can't offer it to everybody, but basically they're income-based. Our internal grants, we can offer IVF for couples that have an income of $100,000 or less, the basic IVF at $6,900, and again it's adjusted by income up to $200,000. The cost share for a patient for basic IVF is $9,900. We also have some financing for those patients who don't have the cash up front. Fortunately, they've been able to utilize our financing program, which seems to be quite fair. We also have, as I mentioned, the IVF studies, so patients who do the ECF grant, as we call it, are able to get the medications covered and even more grant money when they do the IVF study in addition to receiving the ECF grant.
I was once debating somebody on healthcare on television, and he said to me, well, if a patient can't afford $60,000, to have their children when they shouldn't be parents. And I looked at this guy, and I said, did your mother have $60,000 in a savings account when she conceived you? And the guy turned about 5 shades of red, and he said, no, she didn't. So I think that's a really good lesson.